Greetings, everyone. Today, I want to welcome Michael Cortina to the Mom Chief of Everything podcast. Michael is a PTSD trauma resolution expert. He is one of only a limited number of practitioners certified by the Institute for Rapid Resolution Therapy in the United States. People travel from all parts of the country to see him because of the specialty work he does with Rapid Resolution Therapy, or RRT. He is sought out nationally and internationally for his expertise in the field of brain optimization and life transformation. Michael, can you get us started by sharing a bit about yourself and why you are so passionate about helping people who have experienced trauma?
Yes, absolutely. Thank you for having me on. I so appreciate it.
You are
A little bit,
welcome.
about me. By training, I'm a traditionally trained therapist. So I have my bachelor's in psychology, my master's in social work. I went on to get licensed, and I went on to do traditional therapy and working with folks for a number of years. And during that experience, I was getting lots and lots of people who had experienced trauma in their history. And what I realized were a couple of things. And this is a hard realization. One was I was not being as effective as I wanted to be. My success rates weren't nowhere near as high as I would have liked them. The second thing was when there were successful cases, it seemed to take a long time to get those results. And then the last piece was to cause any sort of movement required the individual to experience a lot of pain. And it was like going through rainforests worth of Kleenex in my office. And I actually considered getting out of the field. It just, I always envisioned something more. And this is why I'm so passionate about working with people who have experienced trauma, because what they've been through has been so horrific. There's been so much pain and horror. And I wanted to find an effective and efficient and a much more gentle process to get them clear and resolved of that. And that's really been my quest.
Excellent. And it's unique sometimes when we're struggling something that becomes our passion, because we get so ingrained with, I really want to reach this group of people and I really want to help them. And that kind of drives, okay, how can I get better at this? And then the next thing you know, you're the expert in it. That's it, kind of sounds like what happened with you.
Absolutely, absolutely. That's a great way to characterize it. That it was just this mission to find that secret sauce, to find what can really heal and transform. Yes.
What are some of the demographics that you treat? Is there a specific age, gender, as far as the specialty with certain traumas? Maybe that kind of feeds more into what age it might be. Can you describe kind of your typical patient or clientele population?
Sure. It's pretty diverse. So I work with um, men and women. I work with um, primarily adults, though I've done work with adolescents and just a handful of tweens, that sort of 11, 12 age range. So
Mm-hmm.
it's primarily adolescents, adults, male, female, um, civilians, veterans. And regarding trauma, it's really been pretty diverse. There's everything from single incident trauma to decades worth of trauma. And it could fall under, categories of abuse, whether that be physical, sexual, emotional abuse, domestic violence, exposure to deployments and seeing combat, car accidents, botched up medical procedures, really on and on the list goes. The one thing I like to say, actually, is when I'm doing a training, I'll say there's I'm pretty much a minimalist on the PowerPoints, but I'll show this one slide where it lists the various types of traumas, kidnapping, all sorts of things. But the very last bullet point says, traumatic events are individually defined. That's really the only thing that keeps that slide alive in that PowerPoint, is because what that does is, first of all, understanding that they're individually defined causes the capacity to completely and genuinely remove judgment. We
Mm-hmm.
no longer are in a position of judgment. Well, this person only had this happen and this person had all of this happen. It truly, when you're looking through that lens, removes the capacity to even render judgment on another human being. It's a really beautiful thing. The second thing it does is it opens up that door to say, you know, people's brains are differently, and the same person can experience the same events. You know, we both get in a car accident, we both get T-boned, and I'm not touching those car keys, and I'm certainly not driving down that street anymore. And you get in that car accident, and before you blink your eyes, you're over at Enterprise, like, give me the keys, you're ready to
Mm-hmm.
go. So what's the difference? Well, the difference is the way my brain processed it, laid it down as a traumatic event in storage. Yours, not so much. So traumatic events are individually defined is a way to look at that.
That is that's a great way to encapsulate that, because I think a lot of people, maybe who haven't gone through trauma, or even who have, they may do that comparison game, and that's really not healthy. It's what's needs to be compared is what's happening to them before, at the time, and after. Am I right in thinking that way?
You are spot on. Absolutely.
Okay. And I have people, as a physical therapist, the closest thing to that would be, my friend had their knee replaced. How come I'm struggling and they didn't? That's the closest, and it doesn't work that way. Everybody, that's your knee. And for you, with your clients, that's your type of emotional, maybe it was physical trauma and combined with emotional or psychological trauma. And that whole package kind of fits into that. And you can't compare what's going on with you to somebody else, because nobody really walks 100% in anybody else's shoes.
That you're hitting the nail right on the head. That's absolutely accurate.
You mentioned that you work with veterans, and I know in some of our conversations you had talked about working with military. Are you treating mostly active duty or retired veterans? And do you also work with their families who are kind of watching them go on deployment, and then also have to reassimilate them and change the family dynamic when they return?
Yeah, great question. So I work with both active duty and retired and veterans retired. And you know, it's interesting because there can be different dynamics that play out based on their status. Um, that being said, the goal is always healing, is always brain optimization, is always leveling up and clearing out trauma. As far as their families, I've worked with some, not, I would say I've worked much more with the veterans or active duty than the families per se. It's not that that cannot happen, it certainly can. It just hasn't so much been the case thus far.
Okay. You've mentioned, and even in my intro for you, we've talked about the brain optimization. For those in the audience who aren't familiar with that, can you explain that a little bit more?
Sure. So if we're looking at it under the umbrella of trauma, let's say,
Okay.
what happens when a traumatic event happens is it makes an impression. It makes an impression on the brain. The part of the brain that stores that records that, does so in all sorts of ways. One of the ways it can do it is in unintegrated format. So it's sort of like patchy. You'll hear people say, well, I remember almost like bits and pieces, flashes or scenes, but I can't remember the entirety of the event. The other thing it'll do is it can cause really strong emotions, things like anxiety, fear, panic, anger, rage, blame, shame, guilt, all sorts of things. And what's happening in those instances is the memory itself is being stored in the more primitive emotional part of the brain, hence, whenever it's recollected, it's charged with emotion. So when I refer to brain optimization, it's about getting the brain to reprocess the data about the events. In
Mm.
doing so, a an emotional memory becomes a memory of an emotion. People will say, well, I remember what it felt like to be so disturbed by this, but I just can't get disturbed by it anymore. It then becomes, rather than an implicit fear conditioned memory, a factual declarative memory. Factual declarative meaning like, the name of my fifth grade teacher was Mrs. Smith, and I had Wheaties for breakfast last week on Wednesday. And oh yeah, I was, assaulted when I was 32. Boom, boom, boom. It's just like any other event that's taken place. It removes the emotional charge. Thus, the brain is optimized in reading the data more accurately. I hope I answered that.
Yeah, I like that explanation because I think even for myself, there have been times where when I reflect back on a situation that maybe didn't go the way I had hoped it would go, I can look back and it's almost like I'm looking at it as if somebody else went through it.
Mm-hmm.
Is that kind of what you're describing? And so I'm not, as time goes on and as I kind of learn from those experiences or we're able to step back and kind of go through those experiences in a healthy way, then I can look back and I don't have all the emotions that you mentioned and kind of listed out associated with that anymore. I think we're kind of saying the same thing.
Yes, yes, absolutely.
Now, as you've mentioned, anytime somebody is experiencing trauma, I look at it from kind of just our world around us. And we live in a broken world where a lot of people are unfortunately hurting. And for me, I work a lot with people who have pain.
Mm-hmm.
And with the addictions that, the opioid epidemic and things like that, children are experiencing a lot of trauma at younger ages and then growing up and with a history of trauma and with the opioid addiction that's come into play. A lot of families are being separated because of not just opioids, but other addictions as well. What insight can you give families who are trying to work through trauma like that or who are fostering children who unfortunately have been separated from their family, their biological family, and are experiencing trauma?
That's a phenomenal question. It's prevalent, as you mentioned.
Right.
The level of wow, the level of trauma is through the roof. So one of the things that I share with people and families is this. Well, I might say something like this. I might say, so I don't think that every day people are waking up saying this. Today's the day. If no other day, today is it. I'm going to try as hard as I possibly can to feel as lousy as I possibly can. I don't think people are doing that.
Right.
So if they're not choosing to feel lousy, how can they choose to not feel lousy? See, the emotions, the distress, the nervous system activity, it's coming from a much more primitive part of the brain, not the choice thinking logical part of the brain. That being the case, when families see their child acting out or the teenager acting out, it there's value in thinking about it like this. This person isn't purposely doing this. This person isn't choosing to feel miserable, isn't choosing to do this. There's a lot of nervous system activity that is causing the actions, the behaviors that families are seeing. The other thing is individuals, kids can be triggered by things that the family member in fostering families or non-fostering families may have no real knowledge of. So something happens that seems innocent enough, but it serves as a trigger for that particular child. And then all of a sudden the child's acting out or really emotional or set off in some way.
Hmm.
Understanding that there's triggers that could then set off a chain reaction of nervous system activity, brain activity that translate into behaviors, does this really kind of neat other thing. It allows the families and the parents to not personalize it because it's not personal.
Mm-hmm.
It's not necessarily anything that you did that has caused this sort of explosion as much as it is the individual got triggered. Sometimes the trigger is internal. Maybe there's nothing external. It could just be a memory, a smell, whatever the case may be. And it sets off this flurry of activity. And it truly has nothing to do with mom, dad, sister, uncle, brother. And I think that can help people to take it a little bit less personally.
That's a great point, and a way to. The first thing that I thought of when you talked about smells is I thought of the positive side of that. Well, I think for a lot of people, the smell of chocolate chip cookies, it brings them back. It's kind of like, oh, that's home. And well, the same thing can happen on a negative side, is what you're saying, is that there can be a trigger like that, whereas some triggers create this nostalgic, this feel good type of awareness, whereas a person who's gone through trauma, a trigger can stimulate them that way, and the people around them really are like, what just happened?
You know, I lost everything after you said chocolate chip cookies. That just sounds so good to me. No, that's it. Spot on. That's correct.
Yeah. So I know that you are an expert with the rapid resolution therapy, or the RRT. Can you explain that a little bit more, and why you find it so effective in helping clients who have suffered trauma?
Sure. So rapid resolution therapy it's a short-term healing modality that the aim is to clear and resolve the impact that traumatic events have had on the individual in a way that is very gentle and uplifting and light. So, a couple of things that I find to be a differentiator with the model. Uh, Broadly speaking, sort of high level,
Mm-hmm.
the efficiency, the effectiveness, and the process. So, the efficiency is we're seeing results of clearing up single instances of trauma and complex decades worth of trauma in as little as a single visit,
Oh,
one visit.
wow.
The effectiveness, when I first got trained in this model, I realized pretty quickly that something very dramatically different was happening here as, as my whole paradigm and how I was trained got turned on its head. So much so that I felt compelled to keep data. And so I have this monster Excel database, and I've tracked all my results. And what I'm showing is that the effectiveness in clearing up and resolving trauma is at about 90%. Now, I've done
Wow.
follow up 3 months, 6 months, 9 months, a year, even as far out as 6 years after our visit. And the change held. So it's lasting and enduring. And then the last piece is the process. The process itself is gentle, uplifting, light. That thing that was sort of causing some dis-ease with me early in my career, which was causing clients to experience pain in our treatment process. This is the exact opposite. There is no expectation, prerequisite, or requirement that anybody experience any pain they've already endured and survived, in the process of getting the pain cleared up. Now, I won't say that that's 100%, but it's high. And
Okay.
there are many, many instances where there's laughter in the session, it's light, it's kind of fun, and all in the process of getting the trauma cleared up. One of the things that makes it different is the provider themselves is doing the lion's share of the talking. I mean, you have to hear from your participants in the beginning to get a sense of what the experience has been and what it is that they're looking to get cleared up and resolved. But at a certain point, that shifts, and then it's the provider who does probably 90% of the talking the remainder of the visit. There's no medications, there's no electrodes or hookups, or it's all very holistic and natural in terms of getting the brain, rather, to reprocess the way it's been reading data.
Wonderful. Can you share, obviously we have to protect patient information, but can you maybe share a story about how this worked for someone?
Sure, sure. Boy, there's there's so many. Um, what one gentleman comes to mind. This experienced loads of trauma as a young child, and lots of drugging and addiction in the household, police out all the time, domestic violence, um, sexual abuse, and to the point where it culminated in one night where one parent shot the other parent.
Oh my goodness.
And as he walked up to the parent who was shot and could see the hole in that parent's stomach, said, parents, I'm going to not use the pronouns here, said,
Right.
parents, are you going to be okay? And that parent's eyes rolled up in the back of their head, and the person died right in front of them. That then the other parent was released on self-defense because of the way the whole incident took place. And then that parent, the surviving parent, started, when this child hit about the age of 14, started to prostitute him out to this parent's friends. And so decades and decades and decades of trauma and ruined relationships and horrific addiction. So this individual came in, we did one visit. The visit was about 85 to 90 minutes long, and everything was resolved. Cleared, completed, defeated, done.
Unbelievable. Wow.
Because the individual, he went through a addiction program, and they would do like these 6 month sort of like family follow-ups where people come back, and at 6 months after the treatment, still clean and sober, got actively involved in the community and the church, and was functioning and participating in ways, and the trauma was just completely, it didn't push any buttons anymore. It was really a beautiful thing to see him go through this. There's times where worked with people who were functionally disabled. One woman in particular worked at a bank, and was, there was a bank robbery, and she couldn't go back to work. Just couldn't do it. Well, met with her. We did our visits, and at the conclusion of the visits, I said, so where are you going? She said, I'm going back to work. And back to work she went, and was delighted to be, a productive member of the workforce again. So she went from functionally disabled to functionally able at the conclusion of one RRT visit.
That's exciting. That's got to be it. For anybody who is listening to this and they've experienced trauma, this has got to be really exciting for them. As we start to wrap up a little bit, I want to make sure that my listeners know how can they reach out to you? How can they find you and connect with you? If they want more information, or even just to learn more about what you're doing.
Yes, thank you for asking. So I have a website that just launched yesterday, as a matter of fact, and it's michaelcortina.com. Michael, Michael, michaelcortina.com. And you can, through that website, there's ways to submit applications to get me information. There's ways to email me, contact me in a number of different ways.
Excellent. michaelcortina.com.
Yes.
Excellent. Well, Michael, this has been just great to learn about the rapid resolution therapy, the expert work that you do in association with people who are experiencing trauma. I really liked the description of the brain optimization. I think that really helps people understand that the brain is a powerful tool in the body and can reprocess the data of an event that they've been through. And I also really think that's important to talk about what you said about triggers and how triggers may not have anything to do with anybody, that it's not personal. I think that gives family members permission to say, wait, this isn't about me. This is about the person who's experiencing trauma. And I just think that helps to open up a lot of discussion and not being judgmental about that. So I really appreciate you coming on today. Is there anything else that you would like to share with the listeners in the next minute here?
Sure. Thank you, Dr. DeWitt. Just briefly, the brain is an organ. The brain is an organ. Just like a liver can malfunction, a lung can malfunction, a heart can malfunction. The brain, when it experiences overloads of stress, can experience dis-ease. And there's no shame in that. We have to smash and eliminate the stigma. The brain can be impacted. It's an organ. You have a brain, I have a brain, we all have a brain. We're all subject to the vulnerability of any organ in our body. It's the same for the brain. If you experience trauma, please reach out. There's no shame in it. Thank you.
Yes, thank you for bringing that up. That is such an important fact for people to reach out and seek help. You don't have to do this by yourself. You don't have to be alone in this. It's so important. And I strongly recommend, and I've had patients where I recommend as well, reach out to a mental health professional and an expert, because they can guide you. Your family and friends are great, but they're too biased and they're
Yes.
too close. So
Yes.
they really need that healthcare professional, that mental health care professional, to walk alongside them. And it sounds like you do a wonderful job in that. I appreciate you coming on today. Um, that is all for today. Until next time, be bold, be beautiful, and be you.